simple introduction. So this is Gladys. Some people call me 𝗟𝗏𝗏. Then today we have a special guest. So this is Mr. Owen. Just briefly introduce yourself.
Good evening, everybody. My name is Owen. I'm a owner of Best Friends Dogging Kitty Salon in Singapore. I do dog grooming and dog training.
So very professional in dog grooming, all kind of like how to do our dog 𝗂𝗂𝗹𝗏𝗂𝗏 lah. So Mr. Owen is actually a businessman, but today we would like to share out his testimonial, because Mr. Owen actually joined BE not so long, but throughout this journey, he has experienced a lot of like differences in terms of his health condition. So first of all, I would like to just ask Mr. Owen to share out your health condition, actually how you get in touch with BE and why you want to try our product.
Okay, basically, I'm a diabetic and I have hypertension for the last 30 years. Then about a year plus ago, my feet tend to have a bit of numbness. So when I consulted the doctor, they say, oh, nothing can be done because your nerve probably damaged already. So then sometime early this year, just after New Year, I met up with my sister-in-law, Katie. So she introduced me to this Aulora socks and pants. So so far I tried the socks. After using it for the last 22 days, I start to feel the numbness on my feet all going away. In the past, when I didn't have the socks, I have to use a lot of 𝗂𝗏𝗏𝗏𝗏 plaster, which is a medicated plaster to help ease the numbness.
So means that you have your diabetes for how long already?
30 years.
30 years old. So it's like a very, are you on medication throughout this journey?
Yeah, initially I was on oral medication until probably about 5 years back, when the oral medication didn't seems to be working. Then we substitute using both oral and insulin. So I've used different types of insulin in the whole process.
Understand. So throughout this journey, like I believe that we all need to follow doctor instruction lah, of course.
Right.
Then throughout this journey, you have this diabetes issue. Then taking this medication of like oral medication and also insulin come out to have this so-called is like a side effect also, because you have start to feel like your leg numbness. So you start to wear the socks like just now you did mention to me it's early February this year, correct?
Yeah.
So after wearing the socks, right, you start to feel like your leg, the sensory become like normal. Last time is like you mentioned to me like no, like not so weak sensory. Can you like briefly explain what is the example of not so strong the sensory?
Okay, usually at night you tend to get cramps in the leg. Then during the day, sometimes when you walk, right, you can't feel the ground, like as if you're floating on air. Then
floating on air?
So sometimes if you step onto anything, you can't feel the thing. So now with wearing of the socks, you can feel what's underneath the feet. So it's safer, because with our condition, sometimes when you are, the nerve is damaged, when you get poked by a nail or something, you get infected. Then once you get infection, then you might have gangrene, then you might, worst case scenario, if it's not treated properly, you might have to amputate the whole leg.
Yeah. So we always see like a lot of diabetes patients, if they never take care of their leg, I mean the blood circulation of the leg, normally the serious thing, the first thing, they got some like wound. If accidentally they have some wound, it is very hard to recover also. Yeah, very hard to heal also. So after, I understand that after wearing the socks, yeah, you get a good effect. Then only you start to wear the pants, right?
Yes, yes.
So far wearing the pants, any difference in terms of your health condition?
Yes, also because as I age, normally my knee doesn't have that much of a strength. Even climbing up 2 or 3 flight of steps can be a bit hard. Then after wearing, I find that it supports the knee better, so you tend to have more strength climbing up and down.
So last time you got how to say, knee pain, some sort of knee pain or
knee pain, like arthritis like that.
So after wearing the pants and the socks, some people they are quite worried, like is it heaty or is it like very tight, very hard to wear? Any advice to them?
No, in fact, it's very, very comfortable and it's very cooling. Then it's also good in the sense that it makes your body feel warm on a cold day. Like these recent days, it's been raining here. So usually I have it on inside on top of my uniform itself. So, and also I have also shoulder pain. So with the basic top, it also helps with the shoulder because of my frozen shoulder also.
Yeah, so now actually we are just behind the screen but actually Mr. Owen wearing the full set of this Aulora series. The top, we are actually like matching the 𝗂𝗶𝗲𝗍 like that. Actually, this one is the Aulora basic top and also the pants, also boxer. Mr. Owen also tried about the boxer and the socks. Everything like perfectly boosts up our blood circulation. But not only for that, I understand that Mr. Owen, you also try some supplement on like because you are diabetes patient, so you have like for 30 years, so a lot of things start to came out like how to say tiredness, and you are trying to reduce the blood sugar level. So we get to know there's a very strong this testimonial. Maybe now I will share the things and let our audience see, then you can comment on this. So the first thing is about this. Okay, can everyone see the screen right now? We have a testimonial here. Oh, can see or not? Because I think Facebook a bit slow. That's why I believe I already shared lah. So a lot of people actually watching our live session in the Facebook, but throughout this Zoom session, we can't see the comment. Okay. Yeah, okay, yes, start to appear already. Okay, so Mr. Owen, would you like to share what is this actually? It's like this is the wound recovery site lah, but actually what is this?
It's actually called a 𝗂𝗂𝗏𝗏𝗧𝗏, where you actually have pus growing underneath the skin, which is near my butt, because I sit on the chair the whole day, 8 hours straight. So sometimes we have the build up of heat around there. So sometimes the hair also puncture back into the skin, then you get the infection. So this is, in fact, my second time. The first time it took about 1.5 years to heal. But this round, when I was introduced to Zencoso ball and Shiruto, I realized that you can see from the date there, it heals very, very fast. When I first started was on the 13th, when I started using, then you can see the wound on the 15th, on the 17th, you can see the wound is almost dried up, but you see a small lump on the side. So when I continue to use, then I realized that by the time we hit the 30th of May, the wound have actually healed up. The flesh have actually grown from inside out of the wound and it's closing up. At the same time, you can see the lump down there slowly reducing in size. Then by the time we hit June the 5th, the wound have already healed and the lump have actually disappeared.
Yes, this wound recovery actually very fast, very short period of time, and can see the healing, the wound recovery like 𝗠𝗠 like that. So this one I also consulted with my mom in Chinese. There's one name we call it like 老鼠仓. In English, just now I just researched with Mr. Owen is the folliculitis. Correct or not?
Yeah, correct.
So it's like a big, very big kind of acne lah. So inside there's a pus there. It is how to say, very deep one. So in order to take out, you have to go through one surgery, right, to take out the pus.
Right. They have to cut open and squeeze everything out. Then they shove gauze inside it. Then let the gauze absorb all the pus. Then you pull it.
Like very painful like that.
It's quite painful for the first few days, but I'm actually surprised that it actually healed up within a month. Which in the past never.
In the past, you did mention 3 years ago, you did experience the same thing, but that one take 1.5 years to heal.
Yes, correct. Yes.
Wow. But this one, as you can see, is we can say less than 1 month time. Can see a huge difference.
So the product actually speaks for itself. It works very, very well.
So in terms of this Shiruto, can I know how you consume every day? How many sachet you took for that period of time?
For Shiruto, I'm using 6 sachets 3 times a day. So it's 2, 2, and 2.
Then for the 𝗔𝘂𝗪𝗋 ball.
For the 𝗔𝘂𝗪𝗋𝗀𝗃 ball, I'm using 8 balls per session. So 1 day 3 times. So it's 8, 8, and 8. So it's 24 balls.
Wow. So means that 3 times a day you take together Shiruto and 𝗔𝘂𝗪𝗋. So
Yes.
maybe some of our audience here don't know what is about Shiruto. So Shiruto can help in this boost up immune system and help in wound recovery. And in fact, 𝗔𝘂𝗪𝗋𝗃 is a very rich 8 years fermentation. We gone through 8 years of fermentation of the enzyme. So eventually, Mr. Owen benefited from our Shiruto and 𝗔𝘂𝗪𝗋. It has helped him to speed up the recovery process. As you can see here very clear, the wound just recover very 𝗠𝗠. Oh, this is very amazing testimonial.
Thank you to 𝗏𝗏 company for a fantastic product.
So somehow we have another testimonial. Just let me share. Because throughout this journey, Mr. Owen has very strong confidence after this taking our from at first wearing the pants, and at last he start to consume 𝗏𝗏 products, the Shiruto, and also this 𝗔𝘂𝗪𝗋𝗃. There's one recently you just sent to me the result of this. This is the medical report, right?
Yes, correct.
So this is actually the blood to test the blood sugar, correct?
Yes, correct.
So can you roughly let us know you actually did this regular checkup for every year, and what are the situation for this?
Yes, for the last 30 years, we usually have to do every 3 months called 𝗏𝗃𝗏𝗏𝗃. And you can see from the date on the 20th November, this was done before I have actually consumed any of this product like Shiruto or 𝗔𝘂𝗪𝗋𝗃. So after using it in late January, early February onwards, you can see on the 17th of June, the result have actually dropped from 12.2 to 9.1, which has never been the case for the last 3 to 4 years. And the doctors have been having a headache time trying to increase the dosage of the insulin plus the oral medication. So it's never been able to come down for that long period of time.
Last time, Mr. Owen, when you show me this report, you did mention to me like the doctor even like assuming this time round it will be definitely going to the higher blood sugar level, but
yes,
in fact
correct.
it dropped, right?
Yes, correct.
So the doctor also quite surprised, as you did mention to me.
Yeah, she's quite surprised, but she would not admit that the product is doing its work, because she still feels that her insulin and her oral medication is doing wonders for me.
Okay, this one cannot complain in front of the screen now. But the thing is, we still need to follow doctor medication, their instruction and all that. But this is the real result that Mr. Owen, after listening to the doctor description and all that. But in fact, after trying 𝗏𝗏 products, our Shiruto and the 𝗔𝘂𝗪𝗋𝗃, Shiruto is this one. Can see Shiruto and also our 𝗔𝘂𝗪𝗋𝗃. Then this is the result that he has experienced. That's why he feel very, very surprised. Did you feel like very happy when you are able to see your blood sugar finally there's some result?
Of course, I'm very, very happy, because with the lower sugar result, it entails to less of a health issue like heart, stroke, as well as amputation of leg or arms and whatnot.
Yes, in fact, we have a sideline. Is a very serious diabetes patient last time. Almost going to have this amputation of the leg, but at last managed to save his leg after wearing for the pants also. So from now, okay, I think we will send all this report out after our session later lah. So from now, just now, Mr. Owen did mention the first thing is the socks lor. This one is the socks or the socks. Okay, then benefited from the socks, try confident on the pants, then somehow taking Shiruto and Zencoso. So a lot of people, they have some doubts on Aulora series and maybe the Shiruto and also this Zencoso. Any words that you would like to advise to them?
My advice to them is that don't wait. Give it a try. You need to try to see the result. You can hear a lot of things, but if you don't try, you never know whether it works for you or not. And now that I've tried, I know it works for me. And I'm sure it's going to work for every single people that comes along.
Actually, to be honest, I feel very happy because at first we don't know each other. We like Owen and me, actually we are strangers, but throughout BE products we get to know each other and feel very satisfied when we have a good testimonial keep coming out from our customer, and eventually we become like family like that.
Yes.
So throughout, like Mr. Owen, I understand that you are actually a businessman So businessman has your own business in Singapore some more. So how I realized that you start to do sharing to other people. So why is the needs there? Why you do this sharing to others people? What is in your mind?
Because basically we have benefited from this product, and as like with BE's philosophy, sharing is caring. So we need to share because we want our friends, our clients to be as healthy as possible. All of us, as we age, we have to have a lot of health issues. So with all this product, we can delay or hold back these problems from resurfacing at this point.
Then we can enjoy our life, lor.
Yes, of course.
So health is wealth. A lot of people just say, but to be honest, if whoever watching this video right now, if you have because we all need a very good blood circulation. In fact, Mr. Owen and we are all benefited from Aulora series, and from as a diabetes patient here, share out his testimonial. I believe a lot of people will be more convincing to them lah. They will listen to your story. And I realized that throughout the sharing, Mr. Owen has already achieved our BE trip to Turkey some more. Yay, congratulations.
Thank you.
Or just throughout this simple sharing. And even not only for human testimonial, throughout the sharing journey, Mr. Owen also has some dog testimonial on Shiruto also. This one, dog testimonial, because just now we shared about Mr. Owen is a pet owner in Singapore. Would you mind to share a little bit like how is the dog situation and how they benefit?
Okay. Some of my clients' dogs, sometimes when they have this bad habit of licking, then the skin become raw, then it become infected. So what we did was that we gave them Shiruto, consume, and at the same time apply. Then some of the wound heal as fast as within 2 days. Some that are a bit more problematic may stretch to about 4 or 5 days. But in general, usually by 2 days, the wound would have healed up and you will not see any scar down there.
Just like human, the testimonial is exactly like a human one.
Yes, true.
Yeah, so this is the Shiruto lah. So how is the taste for you? Like, is it delicious? Would you mind to share a little bit on this?
It's very nice. It tastes a bit soury because of the blueberry, but on the whole, it's very, very easy to accept.
And also this one, 𝗔𝘂𝗪𝗋𝗔𝗂𝗹𝗶.
It's very interesting. The taste tastes a bit like 𝗔𝘂𝗹𝗶𝗶 a little bit, but on the whole, very, very nice. I can go on non-stop with eating it.
It like like how to say, like eating the plum or something, because a little bit sour lah.
Yeah.
So this is our sharing for today lah. We are so happy to have Mr. Owen to share with us. Or actually, Mr. Owen has a lot of things to share. So to be honest, I want to show up this this Facebook Live to share his testimonial very long time ago. But because I keep seeing a new testimonial coming out. In fact, also Mr. Owen has benefited from Aulora sock, the leg numbness, gone, now sensory stronger. We just make a quick conclusion lah. Then somehow the pants also relieve the knee pain. Then now Mr. Owen wearing the full set of Aulora series, somehow this Shiruto able to boost up his immune system on wound recovery very fast. And Shiruto together with 𝗔𝘂𝗹𝗶, the enzyme, help to lower down Mr. Owen's blood sugar level, which is the first time ever after 30 years of diabetes. This is the first time see the result of dropping. So very, very good sharing of Mr. Owen. I hope everyone here, I believe everyone here has benefited from your sharing. So thank you so much. So
Thank
you so much. Okay, so we shall end our session today. Bye bye.
Bye. Thank you.
Hey. Okay.